Hi guys, my name is Kristen. Welcome to my channel. I was diagnosed with cystic fibrosis at the age of 4. I had a double lung transplant 19 years ago, and 13 years ago I had a kidney transplant. Today I'm going to be talking about tips for people who have CKD or chronic kidney disease. So drinking enough fluids is very important. I mean, it does depend on your stage. If you're in stage 5, you may not be able to have as much fluids, but in the earlier stages, you probably want to drink about 1.5 liters of fluids, but you should check with your nephrologist because they may have different fluid restrictions for you. I try to drink every 2 to 3 hours so that I'm constantly keeping my kidney hydrated. Now, it's also important not to flush out your sodium. So if you're not eating that much during the day or you're really not taking in enough sodium, I mean, there are sodium limits, which I'll discuss later, but if you're really not eating and you're just drinking, then you could really flush out your sodium, and that's dangerous. So it is important to eat enough and to get labs frequently so that you can tell what level your sodium is at. So as I mentioned, sodium is another thing you need to limit. Your doctor will give you parameters as to how much sodium you could eat in one meal and how much overall sodium you can eat in a day. High sodium levels can cause high blood pressure, which is bad for the kidney, and it can also cause water retention. It's also better to eat more plant-based proteins, as that's a little more easier for the kidneys to process. If you're going to eat meat, I stick to 3 to 4 ounces a day. I try not to eat meat twice a day. I will eat eggs and still have meat, but in general, meat is harder for the kidneys to process, and then the protein just ends up in your urine and not in your body. Usually you're also restricted to not eat red meat or pork, but on a rare occasion I will have some red meat or pork. Protein powders aren't really necessary unless you're getting like no protein in the day and your doctor okays it, but generally speaking, you don't need protein powder. So another restriction is potassium, and again, that depends on your labs and your stages. Usually your doctor will tell you that you can have about 2,000 milligrams of potassium a day, again, depending on your labs. This number can vary, like if you're starting out as 2,000, you may notice that it's too much or too little, and then you'll have to adjust accordingly. Now, things like potatoes, avocados, tomatoes, and bananas are very high in potassium and usually don't eat them, but I still eat, a couple bites of potatoes here and there because it's not as much potassium as eating like a whole potato. So I try not to deprive myself of all the foods that I like. I just try to portion control and keep track of potassium to make sure I don't go over. It's also best not to eat a lot of processed foods because processed foods are high in sodium and they're also high in phosphorus. So you also need to limit phosphorus depending on, again, on your lab work, especially, and which stage you're in. Because different stages, like the beginning stages, you're probably not going to need to limit your phosphorus, but more of the end stages, most likely you'll need to limit phosphorus. They do have phosphorus binders that they might put you on if your phosphorus is too high, and those can be taken daily. There are potassium binders, but they're not usually taken daily. They're usually taken if your labs are showing that your potassium is at a very high level, because high levels of potassium is very dangerous. So they would want to give you the medicine to help bind to the potassium. But again, it's not really used for every day. Another thing that you need to limit is dark sodas like colas or Dr. Pepper, because they are high in phosphoric acid. Root beer is a soda that you can usually drink. I'm pretty sure all root beers, but it's important to check the back of your root beer and see if it contains phosphoric acid. If you're overwhelmed by all the restrictions, it's important to see a nutritionist because they can give you ideas for meals, especially tailored to your labs. So if you're still able to eat potassium but not phosphorus, or you're able to eat phosphorus but not potassium, or you can have phosphorus or potassium, and keeping the low sodium. So the nutritionist really can help you if you're like if you're having a lot of trouble. Naturally, if you have diabetes, it's very important to control your sugar, because the sugars that are too high can really cause a lot of damage to your kidney. It's also important not to have a lot of fear. I have noticed myself that on weeks where I have a lot of fear or I have panic, my creatinine actually goes up. And when I don't have as much fear, my creatinine is more stable. There's things you can do to help with anxiety, such as yoga, meditations, going for a walk, being in nature. Those are my tips for people with CKD. I hope that maybe some of this information helps you, and thank you for joining me. I hope to see you back for more videos.